BBC analysis has found that the number of pharmacies in England has fallen to its lowest level since 2015. 160 closed over the past 2 years, leaving just over 11,000 community chemists. The government's expected to announce an expanded role for pharmacies tomorrow as part of efforts to help patients get better access to GPs. But there are concerns about how achievable that will be. Our health editor Hugh Pym reports.
I'm a second-generation pharmacist. My mum and dad set up the pharmacy in 1982, so we've just had our 40-year anniversary.
Preparing for the morning rush in Birmingham.
I hear lovely stories about my dad and how he helped so many patients when they couldn't get support and advice from their GPs. It's Sanj from Pan Pharmacy.
But for the first time in their history, this pharmacy made a loss.
Thank you.
Staff shortages, higher costs, and more people wanting help is making life difficult for pharmacists like Sanj.
We would love to help support the government, support the NHS, help GPs, but we can't do it with the financial constraints that we're on. We can't give the advice, we can't be there for our patients.
And for some of those patients, speaking to their local chemist is a lifeline.
Hello, Pan Pharmacy.
They've dealt with my sister's meds, my mum's meds, the whole family. Anytime I've ever had a problem, couldn't get into a doctor's, I've come here and they've helped me out a lot.
Don't go to the hospital, go to your GP. Don't go to your GP, go to the pharmacy. So if you haven't got the pharmacy, where'd you go?
I really don't know what to suggest. We are full with deliveries, so I could try and get it out, but it would be the middle of next week.
Tough to make those calls.
Yes, very. There's more and more people wanting delivery, and we just can't get them all in. It's not right, but what can we do?
They've got the potential to do so much more at a point when the NHS overall is under such strain.
Those representing pharmacists in England say real terms government funding has been cut, though they hope a new plan will improve things.
What everyone learnt during the pandemic was one of the 2 places that will stay open is a pharmacy, so lots more people coming for advice and support that we're not paid to provide.
Have we got a new prescription for this aspirin?
300 miles away in the Scottish borders, a solution's already in place. It's a formal contract with the Scottish Government. Unlike in England, pharmacies get paid for every consultation, and some can prescribe medication for patients.
I used to have an English pharmacy, but I sold it, and all the outlets we have now are in Scotland. The Scottish contract is much more patient-focused. They like to get a problem sorted as quick as they can.
Is it a 60 dose or is a 60 dose?
The Department of Health said the services pharmacists could provide in England were being increased and extra investment had been announced.
The government want pharmacies to take on more of a role in community health care. What's your message to them?
I'd hope Rishi Sunak could understand the situation that we're in. His mother was a pharmacist, father was a GP, so they're in healthcare. They understand the pressures, they understand the value that we can offer to our communities.
Would you like him to come here and see for himself?
I'd love him to come and see, to see what we do, again, how patients feel about what we offer, and actually that this is serious and that the sector is crumbling. It is going to fall down like a stack of dominoes if there's not intervention urgently.
Hugh Pym, BBC News.